Our next topic is dementia in Unit 6. Introduction. Dementia is a syndrome caused by disease affecting the brain. It is not a normal part of aging. The condition gradually interferes with memory, communication, behavior, personality, and independent functioning. Unlike delirium, dementia develops slowly over months or years and is generally progressive. Definition. Dementia is a chronic progressive neurocognitive disorder characterized by a decline in memory, thinking, reasoning, language, judgment, and the ability to perform activities of daily living. While consciousness usually remains clear, especially in the early stages. According to DSM 5, dementia is now referred to as major neurocognitive disorder, major NCD. Epidemiology. More common in older adults, especially 65 years and above. Prevalence increases with advancing age. Women are affected slightly more often because they generally have a longer life expectancy. Alzheimer's disease is the most common cause of dementia. Etiology. Neuro degenerative disorders. First cause. Alzheimer's disease most common. Lower body dementia, frontotemporal dementia, Parkinson disease dementia. Second, vascular causes. Multiple strokes, cerebrovascular disease, chronic hypertension. Third rela infectious disease. HIV associated neurocognitive disorders, neurosyphilis, prion disease are rare. Metabolic and nutritional causes like vitamin B12 deficiency, thyroid disorders, chronic liver disease, chronic kidney disease, traumatic causes. Traumatic causes like repeated head injury, traumatic brain injury. Other causes like brain tumors, normal pressure hydrocephalus, chronic alcohol misuse. Risk factors. Increasing ages like in family history, hypertension, diabetic mellitus, high cholesterol, smoking, obesity, physical inactivity, depression, low educational level, traumatic brain injury. Pathophysiology. The exact mechanism depends on the causes. Common pathological changes include loss of neurons, brain atrophy, synaptic dysfunctions, abnormal protein deposits, reduced neurotransmitter activity. These changes lead to progressive impairment of cognitive functions. Types of dementia. Alzheimer's disease. Most common type is gradual onset, progressive memory loss, language impairment, difficulty performing daily activities. Vascular dementia caused by reduced blood flow to the brain often follows strokes. Stepwise prognosis associated with cardiovascular risk factors. Lewy body dementia, fluctuating cognition, visual hallucination, Parkinsonia features, sleep disturbances. Frontotemporal dementia, early personality and behavioral changes, language impairment, usually begins at a younger age than Alzheimer's disease. Stages of dementia, mild stage, forgetfulness, misplacing objects, difficulty finding words, mild confusion, independent in most activities. Moderate stages, increased memory loss, difficulty recognizing familiar people, wandering, behavioral disturbances, assistance needed with daily activities. Severe stages, complete dependence, loss of communication, difficulty swallowing, incontinence, uh, be bedridden in advanced stages. Clinical features. A cognitive symptoms, memory loss, poor concentration, disorientation, impaired judgment, difficulty solving problems. Language problems, word finding difficulty, difficulty wondering, understanding language, difficulty writing and reading. Behavioral symptoms, agitations, aggressions, wandering, restlessness, repetitive behavior. D ହେଲା psychological symptoms like depression, anxiety, delusion, hallucination. Functional impairment, difficulty bathing, dressing problems, eating difficulties, poor medications management, inability to manage financials. Diagnosis. Diagnosis includes detailed history, mental status examination, cognitive assessment, physical and neurological examination, blood investigation, CT scan and MRI brain. Differential diagnosis. Differential dementias from delirium, depression, mild cognitive impairment, schizophrenia. Management, pharmacological management, cognitive enhancers, example, non-pengile rivastigm, galantamine. NMDA, receptor antagonistic. Maintain these medication may help improve or stabilize symptoms in some patients but do not cure dementia. Behavioral symptoms may require additional treatment based on individual needs and medical supervision. Non-pharmacological management, cognitive stimulation, reality orientation therapy, reminiscence therapy, music therapy, occupational therapy, physical exercise, family counseling. Nursing management assessment. Assessment assess cognitive function, memory, orientation, activities of daily living, nutrition, sleep, safety risks, behavioral symptoms, caregiver burden. Ensure safety, prevent falls, remove dangerous objects, supervise wandering patients, maintain a safe environment. Promote orientation, use clock and calendars, label room and objects, maintain a consistent daily routine, frequently reorient the patient. Improve communication, speak slowly and clearly, use simple sentence, maintain eye contact, allow extra time for responses. Assist with activities of daily living like help with bathing, dressing, feeding, toileting, personal hygiene, encourage independence as much as possible. Manage behavioral problems like identify triggers, remain calm, avoid arguing, redirect attention, use assurance. Reassurance. Nutrition like provide balanced meal, encourage adequate fluids, monitor weight, assist during feeding if required. Sleep management, maintain a regular bedtime, reduce daytime naps, encourage physical activity during the day, provide a quiet environment at night. Medication management like the nurse should administer medication as prescribed, monitor effectiveness, observe for adverse effects, encourage medication adverse adherence. Family education like teach caregivers, nature of dementia, disease progression, safety measures, communication techniques, stress management, importance of follow-up. Rehabilitation, memory training, cognitive exercise, occupational therapy, physical therapy, social therapy, supportive groups. Complication, falls, malnutrition, dehydration, aspiration pneumonia, pressure ulcers, infection, complete dependence. তারপরে caregiver stress. Prevention. How to prevent? Although not all causes are preventable, risks may be reduced by controlling blood pressure and diabetes, regular physical exercise, healthy diet, avoiding smoking and excessive alcohol, mental stimulation, social engagement, protecting against head injury. Role of the nurse. The psychiatric nurse should assess cognitive and functional status, ensure patient safety, promote independence, assist in activities of daily living, manage behavioral symptoms, educate caregivers, administer medication, coordinate multidisciplinary care, support rehabilitation and follow-up. Thank you for watching. Jai Jagannath.